Hey, this is Doug Field along with Brent Macy, and welcome back to this segment of Healthcare Consumerism Radio, where we'll have the opportunity to talk about a very important piece of the healthcare consumerism footprint, and that's wellness and health management. And joining us to talk about what they're doing and talk about this space is Pat Trotter, CEO of Trotter Wellness. Pat, good morning.
Good morning, Doug. How are you today?
Good, my friend. How you doing?
I'm good.
Good.
I'm good. It's a beautiful day.
Been traveling all week, and now you at home for a good long weekend?
I'm not home yet. I get home, flying home this afternoon, and then be home for the weekend, Memorial Day for family and everything. So I'm looking forward to it. We're supposed to have great weather.
That's great. To our audience, I've known Pat for quite a while, and they're doing some unique things in this wellness space. And to give our audience a little bit update on, where you are in this space, and then we'll talk about your new launch, the Well Nation platform.
Sure. Well, thank you. I've been in the wellness business since 2003. And have been very successful. I guess that's the good news is ourselves and other high quality programs out there have been successful in getting a return on investment for both the corporations themselves who are paying for it and the employees. And that's the good news. It works. Wellness does work. It wasn't like that 10 years ago. It was hard finding the published results and the studies and stuff. As more studies come out, a couple we've been recently involved in. That's kind of the good news. So it's been 10 years of success that way. I think sort of the bad news is up until a couple of years ago, still most of the programs were fairly costly. They're quite cumbersome, somewhat cobbled together, and not the greatest user experience. So that's kind of where we decided we would develop something quite different for what we call transitions traditional programs. More technological solutions that are more tied into more of the high deductible plans we have today. The consumer, more of a driven consumer and things like that. So we've been successful at wellness. We've been successful with both small businesses and large businesses in documented studies. But we wanted to develop something that really was just a whole lot less time, less effort, less cost.
Yeah. So tell us about this. This is your Well Nation platform, correct?
Yes, correct.
Yeah.
So what we wanted, Doug, is we wanted a program that was really seamless from start to finish. Mm-hmm. And I guess that's the new news, is being able to develop something that is not only requires less time, effort, and cost, but is very simple to set up, real easy to use, doesn't require a lot of management. You can actively monitor stuff, measure stuff, look at your reports, all those different kinds of things that really drive a bottom line of reduced cost, improve output, improve profitability, all the kinds of things that companies are really looking for. But I think most important is it needs to be flexible and adaptable. Mm-hmm. And what I mean by that is each year within our system, you're able to incentivize people differently around what kinds of activities, what kind of milestones, what kind of achievements, all different kinds of things that you can measure, put points on, and then be able to take that flexibility every year to manage the population difference as their profile changes, and not start a whole brand new program. Just go in, adjust all the incentives, and then just lock it down, and that again fulfills the rewards automatically. Because that was the other kind of thing that people wanted. People really wanted something where there would be automatic fulfillment of the rewards. They did not want to have the hassle that a lot of human resource departments had been burdened with. And I guess the last thing really was people were looking for upgradability. Mm-hmm. In other words, one platform. So if you start out as a new company and participatory kind of incentives, and then move to more progressive, and finally to more biometrically driven health contingent / outcomes based under ACA and HIPAA, you'll be able to do that with just one seamless system. You don't have to look for different vendors. A lot of the folks out there are doing good things in wellness, but a lot of their systems are very cobbled together with all kinds of different vendors, and just doesn't take and provide the kind of seamless experience that individual is really looking for, and that's what we wanted to create.
So you can start, if I'm an employer and with my employee population, I can start at a base level and then I can progress with your platform.
Yes.
That's great. Now, Pat, are other wellness players good partners for you? I mean, can a Healthways or and a Lear partner with you, or are they more? I know they compete on certain front, but you would seem to be a partner with some of these.
Yeah, I think the two you mentioned are pretty much competitors, good competitors, quality competitors, and all keep us better at what we're doing. I think the ones we have a tendency to become more aligned with are people who can do like our fulfillment of our products.
Got it.
On the end, the account-based wellness solutions that people can do, meaning the HSAs, the FSAs, the HRAs, where money can be put into those accounts. I think we partner with biometric companies on the front end.
Yep.
And then we also combine with, work with companies who provide services like TPAs. So we kind of integrate ourselves into them to improve their product, improve the member experience, make it more seamless overall. Besides the biometrics, we don't have any relationships. We've got a couple still out there, but for the most part, we've really built everything from scratch, and that was the only way we could have that lower the cost and make it simple to easy to use, flexible and adaptable. The seamless upgrades. You don't have to go reset it every single solitary year that you want to upgrade something. So we did that for 10 years and it's successful, but you just can't hit those price points and that experience level you want, as well as a return on investment.
Pat, you and I spoke at when you were with us obviously at that forum at Expo, and we appreciate your participation there. But we talked a little bit about private exchanges. Kind of the theme at Expo was the explosion of private exchanges potentially over the next few years, and that includes the faster adoption of HSAs. You would seem to set yourself up to be a pretty good partner for some of these private exchanges.
Yeah, I think so. I think I like the private exchanges because, again, anything that we've talked for so many years, we can get the consumer, whether it be transparency or whatever it is, to get them more involved, more accountable, more successful, really makes a lot of sense. But just like other kinds of solutions that have come out in the past, the best ones I've talked to want to make sure that they address the demand side of the solution, not just the supply side. In other words, the only way the exchanges are going to be really successful, much like the successful chamber plans of years ago, was if they do something about the demand side of the equation, meaning make people demand less health care through not access issues or things like that or waiting times, but do so because they've made some conscious efforts to change their behaviors and reduce their health risks, go to the doctor, get the medications, be compliant, all those kinds of things. And I think the most, when I've talked to these guys, they say, well, we're not going to be successful without wellness.
That's right.
And that's exactly what I heard at the conference that we were at from almost all of them.
Yeah, private exchanges, particularly those leaders that are out there getting it done, and pretty much they all say consistently and a consensus that they cannot have a sustainable model without the wellness health management piece.
No. And the hardest part, again, is for a lot of them is to find something. And I'd like to say, we planned this all around being ready for the health exchanges. We didn't. We planned it around what we wanted. Right. The employers told us consistently what they wanted over the last 10 years, but it happens to be very ready for not only a consumer-driven health plan, but also now that the exchanges come in, which kind of take it to another level, which we're excited about, and we hope we have the opportunity to work with some of them. There's certainly a lot that are interested, and I think they're just getting started too, Doug. I think they're just really. I think they're going to take over a sector of the market completely, and I think other parts of the sectors out there are going to have a substantial market share.
Yeah, I think you're
Pat,
right.
when you this is Brent. When you kind of look out at the marketplace, the one big thing with wellness, and this is still happening today, is the gamification piece. A lot of people, whether they launched from that side of the business or came from the traditional wellness side of the business, are you looking at the gamification piece? Is that part of the platform right now?
Oh yeah. I think no matter what people say, I think at some point you have to make it fun. You have to make it social media. You have to make it. Obviously, you just have to make it far more engaging and far more fun for people. People. It's always funny when you start saying fun. You kind of get people looking at you kind of different. But what do you mean fun? Well, that's a fact. It has to be. If you're going to get better engagement from people, it's just the real bottom line. Engagement maintains interests, and how you get that engagement is with challenges, which you call gaining different apps, being able to upload personal fitness device information, communities out there on the social media platforms. All that has to be part of what you're doing. I'm not saying that necessarily someone like myself might do it, but boy, a big portion of the people out there are very, very, very interested. The key with anything that has the game feature to it is just as long as it doesn't get gimmicky, and as long as it still has it still accomplishes its goals.
Yeah, it's got to be easy to use. It's both got to be easier to implement for employers and easy to use by employees and their families. Correct?
Yes. Yeah. Correct. Right.
Now, Pat, when one of the things, and you had alluded to it at the beginning of the segment, is that employers were looking at it and saying, okay, where's my ROI with this health and wellness program that I've put in place? What would you say to an employer around the question of ROI and their health and wellness program?
Well, the return on investment an employer gets from it and an employee gets from it are one and the same in some ways. Let's talk about that first. For the employer, it's hard dollars. How much should I invest and how much should I save? And how much should I save in healthcare costs, workers' comp, short-term disability, absenteeism, and productivity? So those are all the kinds of things that we measure, not just health claims. So that we can prove to somebody, and I'll talk about that in a second. But the other one is the employee themselves. They're putting time, effort. They're getting their blood tested, pain. They're putting pain in if they're exercising, according to them, so they're making commitments. They're putting an investment into it. And it's not a good system where they get rewards and they get achievements that make them feel good and their health actually changes. It's not worth their investment. So the investment has to be both for the individual as well as for the employer. For the employer, I can pretty much sit down and talk with the employer and says, how much do you want to do, how fast do you want to do it, how much of incentive you want to put in, and what are your current claims. And you can almost predict for the percentage on what their return on investment will be. And you can even predict more accurately once you have their health risk data, particularly the biometric values and the health risk from the health risk assessment. But you can get a return on investment. You can get it the first year. In fact, when there was a study just published 2 weeks ago in the American Journal of Occupational Environmental Medicine on 120-some companies we did out in Colorado that showed even among small employers, and Getzel was the one who published it, you can get a return on investment of 2 to 1 in the first year.
Hey, Pat, we got about 30 seconds to go and really enjoyed having you on the program. You want to leave our audience with a final thought?
I guess the most important thing for us is out there is almost anything you're doing in wellness is good. There is no bad thing you're doing in wellness. If you're doing anything with your employees or anything with your employer and you're doing something to figure out a way to improve your health, to increase your awareness, it's all good. And don't anybody tell you that any kind of program, whether it be exercise or a walking program, it's all good. The question really comes down to is where do you want to go and when do you want to get there relative to both your investment as an employer and your personal health as an individual.
Thanks, Pat. Really enjoyed your participation with it. Thanks for taking the time. Enjoy your weekend and say hello to Margaret for me.
Yes, thank you. Thank you both, and have a great Memorial Day weekend.
Thanks, Pat. Take care. To our audience, stay tuned for the next segment, Healthcare Consumers and Radio.